Dr. D. Sangeeta is currently a senior lecturer at the Department of Chemistry, Anna University, Chennai. She has completed her PhD in the field of polymer chemistry from the University of Madras in the year 2000 and has teaching and research experience of more than 10 years. Her research interests are in the following fields: fuel cells for clean energy, functional membranes for desalination, and polymers for biomedical applications. She has published more than 20 research articles in national and international journals and has more than 40 research articles in national and international proceedings. Presently, she is guiding 6 research scholars for their doctoral degree.
Welcome to the UGC lecture series on the topic of polymers in drug delivery, part 5. And in the previous part, we were talking about the different methodologies or techniques available to develop the polymer drug delivery systems. As a continuation of this, in this part, we will be doing with 2 more systems, that is ion exchange systems and hydrogels. This is in addition to the methods like co-aggravation, co-precipitation methods, Wirtz methods, and osmotically controlled methods, and so on, whatever we have seen in the previous episode. After doing with these 2 systems, that is ion exchange methods and the hydrogels especially used for drug delivery systems, some of the recent inventions or the new methods that have been developed in the recent past will also be discussed in this talk, like the one called as dendrimers, ring cap technology, Pulson cap technology, and then molecular gates. With this, we will touch upon the conclusion and come to a conclusion session of this particular topic on drug delivery systems, where polymers are being used in an enormous way. Let us first go into the ion exchange systems. Ion exchange systems basically consist of ion exchange resins or the ion exchange polymers, and these ion exchange resins or polymers are the cross-linked water insoluble polymers with a number of ionizable functional groups that are attached to the polymer system. They are basically a 3-dimensional networked cross-linked structure which contains a number of functionalized groups, and these functionalized groups are ionizable in nature, and such groups are present in a repeated fashion throughout the structure of the polymer, and they are responsible for the delivery systems. So, such ion exchange systems generally use resins that are composed of water soluble cross linked polymers. In that case, these polymers become water soluble because of their ionizing nature, which is present as the functional groups throughout the polymer, and due to the swelling and due to the dissolution of the polymer in the presence of water, they release the drug. This is the basic principle behind using the ion exchange systems as the drug delivery systems. And these polymers, they basically contain salt forming functional groups in repeating positions on the polymer chain. The drug is bound to the resin and released by the exchanging process with appropriately charged ions in contact with the ion exchange groups. This can be schematically explained by this reaction, where we have the basic polymer exchange resin. Let me say that it is a cationic resin and hence carries a cation fixed on its polymer chain, and the drug, the one which is going to be the negative part, is going to be carried along with the polymer chain which contains this fixed charge, and hence they have the capacity to get the drug, which is the negative portion, to get ionized and then to get attached with the polymer system. When such a polymer with the drug containing into that is going to be put into the body, when there is a presence of other ions available in the system, the exchange process takes place. For example, if we have X minus, it could be a chloride ion or a sulfate ion or any other anionic ion that could be present in the medium, which has the potential capacity to exchange the drug portion with this. So, this polymer leaves the drug into the system, and in turn this X minus ion goes and attaches itself to the polymer exchange system. So, what happens finally because of this reaction is the resin remains positive instead of the drug which has been carried by the resin is released into the system, and instead there is an exchange process taking place for the X minus ion to come and get attached to the polymer system, where this X minus ion in the system is available as the ions which are present in the GI tract. So, when you have such anionic ions present in the GI tract or in the system body system, they get exchanged with the drug portion, and instead the drug gets released and then goes into the body and then it does its action. So, this is the basic principle behind the ion exchange systems. Then comes the hydrogels. Hydrogels are slightly different from the ion exchange system in a way that the ion exchange systems, because of their ionizing character, they dissolute or dissolve in a suitable environment, thereby releasing the ions in an exchange method. In the case of hydrogels, they do not dissolve, but they undergo a swelling process. That means they go on be absorbing the aqueous medium around them. It could be a water, it could be a body fluid, it could be anything in the body system which can be allowed to get into the system, and it gets swelled, and because of the swelling process the release is going to take place. So, in the case of hydrogels, hydrogels consist of polymers that swell without dissolving in an aqueous environment, that is in water or any other biological fluid. And at equilibrium, such hydrogels, they comprise basically of 60 to 90% the fluid, and it is only to 10 to 30% of the polymer is going to exist. That is, at the time of equilibrium, the polymer or the hydrogel swells to such an extent that it is going to have by weight 60 to 90% of the fluid, that is a water or the aqueous medium or the biological fluid that is going to come from the system, whereas only 10 to 30% of the weight is going to be due to the basic polymer or hydrogel material that is added. So, this is what is going to happen at the time of equilibrium. And the factors that is going to influence or affect the release of the drug would include many. For example, it could include the pH of the system, ionic strength as well as temperature. That means, the release of the drug is going to depend on these three important factors, whether the pH is acidic or alkaline, under what condition it has a capacity to swell and release the drug. And the strength, ionic strength also decides, the concentration of the ions also decides the swelling. And the temperature, of course, the temperature generally increases, but again it has a slight influencing factor on the release of such drugs from the hydrogels. And the polymers that are more commonly used in the hydrogel systems would include poly N isopropyl acrylamide, polymethacrylic acid and polyethylene glycol. All these polymers are very commonly used hydrogels which has a capacity to swell to a greater extent when they are put in an aqueous system. Especially the polyacrylic acid is very good hydrogel, which is basically a cross-linked hydrophilic 3-dimensional polymer network that is highly permeable for the release of the drug to take place from the inside of the hydrogel to the external environment. And such hydrogels, that is a polyacrylic acids, do not swell in the presence of water unless they are being activated by a particular method. Otherwise, the swelling does not happen for them. They will have to be initiated or activated by a suitable optimum condition, which in turn allows the swelling to take place. Ultimately, the release of the drug is going to take place from the system. Now, how does the mechanism work? In the case of hydrogels, swelling activated by pH, temperature, or even the electric field can also activate the swelling. And during the drug release, that is when the drug release is happening via void generation and diffusion. So, the drug release happens due to the void or the pores that are generated and subsequently by the diffusion process. The diffusion rate is generally regulated by the cross-linking ratio or the effect of cross-linking that is available in the polymer system. So, this is the schematic representation of the hydrogel release. You have the polymer, which in turn contains number of monomer units linked together, and such polymer chain are linked or cross linked, you may call them, as they are cross linked at specific regions, and the drug is going to sit inside the polymer. When they are added to water, they get activated, they become swelled, and when they are getting swelled, the polymer chain becomes like this. So, this swelling depends on the amount of cross linking or the density of the cross linking that is available in the hydrogel system. So, when there is a swelling like this, definitely there is going to be the release of the drug from the inside of this system by diffusion process. Let us talk about the dendrimers. Very recently developed methods and techniques would include one particular system, that is your dendrimer. Dendrimers are branched and spherical larger molecules. They are basically spherical in roughly spherical structures with very high branches developed on them, and they are also larger molecules. When you have number of branches available in the same polymer, they end up with certain functional groups at their terminal end, which are responsible for the carrying of the drug and release mechanism. So, an ideal candidate among the model hyper branched polymers, they are supposed to be the more ideal candidates among all the hyper branched polymers, that is the dendrimers, because of their well defined structures and high density of functional groups. Naturally, these dendrimers have a well refined perfect structure, predictable structure, along with a number of branches that are arranged to them, which has a predictable density of the different functional groups that are available at the terminal ends of the dendrimers units. And use of such dendrimers or the nano structured systems for targeted drug delivery is being explored in an enormous way. This may be achieved by attaching the ligands or the antibodies to the surface groups and using the multivalency effect to improve the target ability. Let us look into these characteristics, the important salient characteristics of such dendrimers. Such dendrimers, they are characterized by monodispersity. Monodispersity means all these dendrimers have a defined molecular weight. There is no difference in one molecule to the other molecule, which is always the case in the case of the polymers. Polymer sample, we cannot simply believe that all the polymer chains will have the same molecular weight, but in the case of dendrimers, the chain length is shorter, predictable, and the same kind of functional groups are available throughout the branched down terminal ends, and you do not have any difference between one dendrimer molecule and another dendrimer molecule. Each one of the dendrimer molecule in a particular sample will have the same molecular weight, and hence you call this as monodispersity. This is one of the important feature of the dendrimers. And the second one is water solubility. All these are soluble in water, and hence the release is going to take place very easily from such systems. And then the encapsulation ability. This is the most important character for the dendrimers because of the presence of the shorter branch chains which are available in the molecule. They have a specific ability for the encapsulation of the drug. It will not differ from one molecule to the other molecule. It is going to have the effective ability for the encapsulation of the drug, because each one of the molecule is going to have a number of functional groups that are required, that are going to facilitate the hold of the drug and the release of the drug, and this is highly dense in the case of dendrimers, and hence the capacity of encapsulation is also very high for the dendrimers. Then comes the large number of functionalizable peripheral group. So, it means the same actually, because they have large number of peripheral attached functional groups, they are going to be responsible for the movement of the drug that is going to take place on either ways. So, this is supposed to be a schematic picture of the proposed structure of the drug dendrimer complex with the targeted moiety. It may look like this. So, this is the dendrimer molecule, and these red portions, they indicate the targeting ligand or the antibodies. You have certain portions where you have the imaging agent, which is going to image and then locate the place of drug delivery, and other branches can be responsible for carrying the drug. So, in the same system, it is possible to achieve all these three functions happening in the same dendrimer molecule. So, this is supposed to be the proposed structure which is going to gain more importance in the future. And this is an example of a dendrimer which is being used already. It is the polyphenylene dendrimer, the crystal structure of which is put over here. So, you have a branched structure like this, and this structure was proposed by Mullen et al. Let us have a short break and then continue with the rest of the technologies. Welcome back after the short break. The next technology is the ring cap technology. Let us talk about this particular technology which is already in use. This technology is based on a tablet which is usually a film coated one. The tablet is partially coated with a series of rings as shown here in this picture, and these rings can be made of any insoluble polymer material that does not erode or degrade during the dispensing period. During the period of dispensing, these colored rings, which are due to some insoluble polymer materials, they never degrade or erode. And such number of rings, their position and the thickness of the rings, all these three, they contribute or they say about the control the rate of release of the drug in the final dosage form. All these thickness, your distance, your position where the ring is available, they have a control over. They tell you the rate of release of the drug when it is going to happen during the dosage time. There is one more technology called pulsin technology, slightly different from the ring cap technology. In this case, it contains a water insoluble capsule body along with a water soluble cap. So, you have two parts here. The bottom portion shown here is the water insoluble capsule body, and the top portion is a cap which is basically water soluble. And the capsule body contains the drug and the hydrogel polymer that are capable of rapidly expelling the drug at a predetermined time. So, this particular capsule body, which is an insoluble material, is going to contain the drug along with the hydrogel. That means, the hydrogel is the basic system present. The hydrogel carries the drug and is available within the body of the capsule at the bottom portion here, and they get released because of the soluble gelatin cap that is going to be present at the top. So, what happens when they are loaded with a hydrogel containing the drug in the body? As the soluble cap erodes or degrades, the hydrogel inside the body swells and pushes out the drug very easily. The hydration rate depends on the hydrogel plug, the length of the plug, and also the fit ratio. Fit ratio is nothing but the one which refers to the plug diameter to the body diameter, plug diameter to the body diameter, that is called the fit ratio. So, all these three factors, that is the length of the plug, the fit ratio and the hydrogel plug, all these are going to determine the hydration rate, in turn the releasing rate of the drug from the inside of the system to the external environment. So, this is called the pulsin cap technology. Having seen the ring cap technology and the pulsin cap technology, The other important recently developed method is molecular gates. How are these molecular gates very useful in the drug delivery system? A new gel has been developed that is used to make such a system called molecular gate. The gel actually expands at high pH and shrinks at low pH. That means the gel which is going to behave as a molecular gate has the capacity to either shrink or expand depending on the pH value, depending on the outside pH, whether it is acidic or neutral or basic, it is going to behave differently. It is going to either shrink or expand. In this case, the gel is going to expand at high pH and it is going to shrink at acidic pH. So, this is the picture of a normal glucose level where the pH is going to be 7.4, very close to neutral, and let me say the insulin drug is available here which is contained within the molecular gates, and this gel represents the molecular gate. You have the blood supply outside, that is in our body, and this is supposed to be a porous material. What happens to this system at different pH? That matters, or that defines the release of the drug that is going to happen in the application. So, here what happens when there is going to be a higher glucose level, the glucose level when it is shooting up, the acidity is going to be prevailed in the system, or the pH comes down to a lower value of 4. At that 4 value, the molecular chain, this molecular gates are going to shrink. They are going to shrink at low pH. When such a shrinking is going to happen, automatically the opening of the gate happens in between, and hence the release of the insulin into the body system, into the blood supply is going to take place. So, during the acidic pH, when the opening is taking place, the insulin goes in. Automatically, when the pH is going to be risen up once again, they are going to expand and then they are going to subsequently close, get closed. The gates are going to be closed like this to stop the release of the insulin. So, the gel contains two polymers basically. The molecular gate may use two different polymers basically. It is going to be polymethacrylic acid and polyethylene glycol. So, let us have a detailed report on the same case. Adding the enzyme glucose oxidase. So, when the glucose oxidase enzyme is going to be added, it causes the gel to respond to the changes in the glucose levels, because the glucose and the enzyme, that is your enzyme glucose oxidase, chemically react with each other in order to produce an acid. Hence, due to the production of the acid, the gates would shrink or open, let me say, at low pH, and hence the release of the insulin takes place. As the glucose level drops, the pH once again rises, causing the gates to expand and hence block the release of the insulin. This is a basic mechanism of, or the working mechanism of the molecular gates. So, now we have come to the conclusion of all these 5 different parts what we have seen. In the earlier parts of this biodegradable polymers, we had an introduction about the advantages and disadvantages of making use of polymers for such delivery systems. We also talked about various mechanisms. We also talked about erosion methods, that is surface erosion, how the bulk erosion are different, which is more relevant and which is more active in which kind of situations and all. And in the previous 2 lectures, we have talked about the different technologies and techniques that have been developed to fabricate such drug delivery systems. Having seen all this, we have come to the conclusion of this part 5. The knowledge and the skill in the areas of polymer technology is going on expanding rapidly, and this cutting edge technology has generated a substantial number of polymers with a wide range of degradation rates. This has widened the horizon of the options that the researchers and the scientists have at their disposal for controlled and targeted delivery of a whole array of therapeutic moieties. Hence, we have a great future for developing these technologies using various polymeric materials, and the scientists and the researchers globally are working on with such different polymers and methods, how they could be very useful in our future applications, especially for the release of drugs at various requirements. So, as a summary, in today's part we have talked about the methods of controlled drug delivery with a special reference to ion exchange systems and hydrogels, and some of the newer methods or recent methods that are under development have also been seen. We have seen about dendrimers, ring cap and pulsar cap technology, molecular gates. Here are few questions. What are hydrogels? And name few commonly used polymers as hydrogels. What are dendrimers? What is the difference between ring cap and pulsar cap technologies? What are molecular gates? Thank you.